Cholera continues to be a global threat to public health and a key indicator of lack of social development. Once common throughout the world, the infection is now largely confined to developing countries of Africa, parts of Asia, the Middle East, South and Central America. In Nigeria, the outbreak of cholera has remained persistent, occurring annually mostly during the rainy season and more often in areas with poor sanitation, overcrowding, lack of clean water and food, and areas where open defecation is common practice. Now, the recent outbreak of cholera in Bauchi State has continued to generate concerns from health officials across the country. Reports from Bauchi State indicate that 322 persons have been infected following the outbreak of the disease in 9 local government areas of the state. The outbreak has been attributed to open defecation and consumption of contaminated water following recent rainfall. Now, how deadly is this disease? What is being done to achieve a cholera-free society in Nigeria? These are some of the issues going into the conversation on containing the outbreak of cholera. My name is Victor Azu. Welcome to the program. With me here in the studio is Dr. Basi Okposin. He is the Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Welcome to Nigeria Today.
Thank you. Good evening, Nigerians.
And joining us via Zoom is Dr. Rilwanu Mohammed, Chairman, Bauchi State Primary Healthcare Development Agency. It's a pleasure to have you join us.
Good evening, Nigerians. Good evening, NTA.
All right, let me start with you, Dr. Mohammed. Tell us what exactly is happening in Bauchi State. As at the last count, over 300 persons have been confirmed cholera positive. How did it spread so fast? And what is the source of this current outbreak?
No, actually, we started hearing about the sporadic diarrhea and vomiting in one of the local government, Magami community in Ningi local government area of Bura district. And they reported around 21 number of cases of having vomiting and diarrhea. Then the first index case was a 37-year-old woman who actually reported to Bura General Hospital, and then with abdominal pain, vomiting, and diarrhea. Then from there, we started having reports from Bauchi local government, Warji local government, and Giade local government. And then we quickly took samples of some of the victims. We found out that out of 21 samples, we used rapid diagnostic tests, which we actually been supplied by the Nigeria Center for Disease Control. We found out that out of 21, all of them were positive for rapid diagnostic tests. Then we went again to inoculate the sample to culture. And we found out that in the culture, we have about 19 out of the 21 that are positive for the same Vibrio cholera. So we now confirm that we are now dealing with Vibrio cholera. Then the Honorable Commissioner of Health actually activated the rapid response team on the 26th to actually look at where can we do now, what happened, how can we now foretell the spread of this disease. We quickly set up centers in all the general hospital, cholera unit in all the general hospital of Bauchi State, activated about 4 treatment centers in Bauchi town itself. In the teaching hospital, ATBU teaching hospital, we activated one in the state specialist hospital. We activated another treatment center in the 4 primary healthcare centers within the town. Then what we did is actually to invite all the rapid response team involving all other stakeholders like RUASA, like Water Board, like the SEMA, so that we come and look at how we articulate our response. Then we now notified the National Primary Care Center for Disease Control. Actually, cholera is a notifiable disease. We inform them that, look, we have this kind of, we inform the director NCDC, DG NCDC, that, look, we have sort of diarrhea and we have confirmed that it is a confirmed cholera. We have done the test in Bauchi State. We don't need to go to anywhere because we have lab scientists. Then after that, we quickly sworn into action to actually mobilize the community by informing them in radio and television, involving the traditional rulers, religious leaders, to inform them about the issue of washing of hands, making sure that they boil their water. And then other communities started springing up, like Misa. Our local government started having cases, like Darazo local government started having more cases. We have more cases again in Shira. We have now 9 local governments that are now having the same kind of response or diseases. Then we now try to make sure that we start activity of managing the patients. We bought all the consumables. We mobilized doctors, nurses, and paramedics to the field, actually to the treatment centers. We make sure that we start actually controlling. The most important person that came to support us in Bauchi State are the Doctors Without Border. They are already here in Bauchi to carry out survey on cholera issue. And then they are here. We just came at the time they came to find out what was happening, that this year there was no cases. No matter that we're already having outbreak. Then they are mobilizing their headquarters, particularly the Doctors Without Border from the Switzerland. They now started getting their supply only yesterday. So the Bauchi State government gave us some amount of money to start managing the patients, in which our Honorable Commissioner now actually directed that all the local government area of Bauchi State should start looking for cases, active case search. Now, what we did in the town, particularly in Bauchi town and in Toro local government and local
Dr.
government,
Mohammed, let me put you on hold here. We'll get to the other issues. But let me put you on hold here meanwhile, and let's get to Dr. Okpose. It's interesting to note that you have a coordinated response from the beginning, and that's good to see. But let's hold on here, get to other issues, and we'll be back with you. Thank you for your opening shot. Now, Dr. Okpose, this disease, cholera, how exactly is it transmitted?
Now, cholera is a bacterial disease.
Okay.
Once someone is infected with it and passes to, is from these two, the feces, the person passes, that will either contaminate water, food, or the environment.
Okay.
And that is why you see it during rainy seasons like this. Once the person that is infected passes to that has the bacteria, it's easy for the rainwater to wash it off. And worse where you have the environment dirty, worse where you have a stream that is like a pond that people go to fetch from that places. And then they want to swim and do other things from the same water they fetch to go and drink. Some, the open defecation of this person that is infected, flies will sit on it, contaminate food, or the water that is taken from there is used to wash food that we take, fruits, and cook things that are not properly boiled. Okay. So that contaminated water, that contaminated food that is eaten by another person who is not suspecting there's something wrong with this water, there's something wrong with this food, that can bring this person down. But the thing with again with the environment, if the poor sanitation in the environment, where flies as well were also contributing factor. But you see, it's not that it's as very deadly as people think, because out of every 10 persons that is infected, mostly you see 1 out of every 10 that's supposed to come down with very serious problem. So when you see massive like that, there's that area deserves an attention where we need to look at their water source, we need to look at the environmental sanitation, and give them the support that they need so that it doesn't spread more than what it is.
And that brings us to susceptibility. I was going to ask, who is most susceptible, for instance? Are some states rather more vulnerable than the others? Why?
The susceptibility, like I say in the opening statements, really depends on the environment.
Okay. Apart
from the human factor, the environment. An area without adequate supply of water, an area with sewage disposal very poor, an area with poor sanitation, and then add it all generally, weak immunity maybe from poor feeding, an area that generally people don't eat well, that their immunity are naturally poor, this kind of environment are very good breeding sites for us to see cases of cholera.
All right. Thank you very much indeed, Dr. Musa. Let's get back to Dr. Mohammed. Dr. Mohammed, now we are talking about water and the other contributory factors to the spread of cholera. Now, how is the state handling the current situation? You've given us a bit of it. Is there any remedy at all? And from what we know, what is the state of water in Bauchi as we speak?
No, actually, when this government of Senator Bala Abdulkadir Mohammed came, we realized that the water in Bauchi was a real problem. So he started to reactivate the treatment plan and try to construct the treatment to make sure that he expand the treatment center and storage facility in the town, in Bauchi town. Because since the creation of the state, the pipe were already broken everywhere. And then within that activity he is carrying out, the water was switched for about 3 months to actually make sure that they carry out the circulation of the water in the whole town. So when they now brought the water, we are thinking that maybe one of the possible cause of the outbreak will be during the switching of the water, the pressure inside the pipe was low. So those pipes that were broken, they were changing, now move the waters. Some pipes are within the gutters, so they now move into the pipe. So when they return the water back after 3 months, they didn't send excess chlorine. Or they have to put excess chlorine, but maybe they have not put excess chlorine. The second possibility of this outbreak is the open defecation in many places in Bauchi State and in the urban and in the rural areas. So the pest rain came and washed the open defecation into the well that we are still using, and then that may be another cause. The third cause is the coming of the fruits. There are so many fruits that came out, including mango and others. So people are not even washing, and the rain has not yet worked on the mangoes, and we are still taking those mangoes. So that was maybe the cause of outbreak of diarrhea. So maybe not all the diarrhea may be cholera. Some may be food poisoning from these sources of. So we have already, what we did in Bauchi State actually is to actually find out, to carry out survey on what was the cause of the outbreak. We have already articulated our point, and our questionnaire is ready. We are going into the field. The second one, we activated an incident action plan. Incident action plan is actually to know how much we are going to spend on the management of where are the area, what is the activity in each pillar. These pillars, there's coordination pillar, we have treatment case management pillar, we have logistic management pillar, we also have a water and sanitation pillar. And then these pillars are activated and they have an incident action plan and costed action plan so that we know how much we are going to do, how do we take care of this. So one of the remedies that we did is actually the water board provided tanker to those communities where there was an outbreak. Naturally, most of the places that are outbreak, they are really deep inside the local community within Bauchi town. You hardly had an outbreak inside the GRA here in Bauchi, in the same town or in other places. So we now want to use the same area and to provide water immediately in those communities every day. And we are supplying them with diesel, they provide those tankers. The second thing is that every household where there is line list, the name of the community, the household, we went into to contaminate the household, to make sure that we contaminate the whole household and the well. So most of them, maybe the source may be the well in that house. So we continue doing that to make sure that we reduce the outbreak. But we're having more and more communities coming out again. Apart from the ones where we are contaminating, no more. There may be no more outbreak from that side. Another quarters, another compound, another places are coming up.
Well, I think we're losing the connection to Dr. Mohammed there. But it's about time that we go on a break. Let's take a breather and take a message while at it. Nigeria Today will return afterwards. Please don't go away. All right, welcome back. This is Nigeria Today, and if you've just tuned in, we've been discussing cholera, and Dr. Posen here will be talking us through at about now what the national outlook is. What is the outlook nationally? What's the situation with cholera in other parts of the country?
Okay, we'll start globally and zero down to Nigeria. Annually, we have about 2.9 million reported cases of cholera.
Okay.
And most of these, 90% of them contributed by Africa. And out of these, we have about 95,000 of these people die every year. From Nigeria alone, and like you've seen this year, this is the third state we're seeing reporting large number of cases so far this year. Earlier part of the year, we had the case from Benue State, and where the national supported them with vaccines to respond to it. And the state government also had an effort to ensure that the control was brought under control. We've also seen from Bauchi State here now. So in a year annually, we see depends on the year, between 20 to 60,000 cases being reported in the country. But the point here is, like you made earlier in your introduction, we shouldn't allow any of our brothers, sisters to die from cholera, because it's something that can be managed. All we need for us Nigerians, the very basic things that we need to do not to allow this happen to us, is having adequate and safe water at all times, whether it is the water for drinking or the water we want to use to cook or water we want to use to clean anything we want to do. That adequate and safe water is very important.
Okay.
Secondly, we talk about frequent hand washing with soap. And you see, it's the same principle when we are talking about COVID-19. You can see it is not just COVID-19, even in the cholera and other diseases that we can pick and transfer into our body, it causes problem.
Indeed.
So that regular hand washing with soap, very important. This will not come to us. You look at, again, something else, people might say it's simple, but it's not done in most places. We need to have toilets that our feces are buried. If in the local area where you don't have WDC, at least there should be a pit latrine that is covered, where people, when they defecate, they cover it. We don't give access to flies to pick it, go and contaminate food. If rain comes, it will not wash it into the well or the stream around it to cause problem. And then if we are cooking, we cook with safe water. We allow the food to cook adequately. For people that live around the coastal line, the shellfish, when not properly cooked, can transmit cholera, because it harbors the bacteria there also. So if you're living along the coastal lines, cook those seafood, cook them properly and eat. It will prevent against this. And then general cleanliness of the environment. So
but at the moment, Dr. Posen, is it only Bauchi State that has this cholera situation? Is there any other state in the country that has
actively, there is no other state that's having the active case. Like I mentioned, the Benue instance was brought under control, and then a few local governments Kogi was also brought under control, and it is the active case that is in Bauchi now. And I want to thank the Executive Secretary Bauchi Primary Board and the government of Bauchi State for the quick response, because if not for the quick response by the state, it would have gone far beyond what we are seeing.
All right, let me get back to him, by the way. Dr. Mohammed, well, what's the situation now? What's your assessment of the situation from when it began to this point? Would you say that there's progress being made in trying to contain the situation?
No, actually, what we did actually is to invite all the stakeholders I told you, so that we'll be able to contain this disease quickly. And we don't want to put any issue because all our neighbors are reporting cases like Gombe State and Kano State. Even the border of Kano State was Somalia local government with Pura. That is the district where we had the first index case. So maybe the contamination is from there, but we don't want to join case issues with any. We want to see how we can control this infection. One thing that we plan at that time is that we immobilize Bauchi State Environmental Protection Board to go into household with environmental officers to see if there are any house that has spilled sewage so that they can evacuate it. They evacuated about 22 now. Now we also invited the Ruwasa to make sure that in area where we need their support and the BASEPA to remove the solid waste, they are doing that immediately. And then the MSF, that's the Doctors Without Border in Bauchi State, they are trying to construct the cholera treatment center today, but they brought all their consumables from Lagos, and then they were going to set up a cholera treatment center of about 200 beds, and they are constructing it right now. And then we don't want to wait. We started the risk communication in radio and television to inform the public. We mobilize our people at the local government level to continue synthesizing their community so that people will now know that it is actually lack of washing of hands and drinking bad water that we get this disease. So we intensify that by using jingles in our radios so that people are hearing radio more than television in the local community. And then we also mobilize the religious leaders, traditional rulers, so that this activity can be galvanized. The local government chairmen were involved. The other ministries, I told you, is a joint work to see that we curtail and reduce this outbreak. Now, as of yesterday, we have 300. So today we have 360 number of cases, and then we have 21 additional deaths yesterday from one of the centers in Giade, and then the case fatality rate is about 5.8%. We are trying to see how we can quickly mobilize the community. We are even trying to. We invited all our information officers, education officers to the state tomorrow, so that we carry out a lot of work in going house to house, and then we'll be able to make sure that this cholera outbreak is contained.
All right, thank you, Dr. Mohammed. I was going to ask why these actions appear to be reactive. Is there any plan to sustain all that you are doing now to ensure that you don't have this kind of situation ever again? I'm told I'm running out of time, if not completely. Can we take this in 15 seconds?
You know what we did when this government came in 2019? We now map out the cholera hotspot in Bauchi town, in some area where we have outbreak like Toro, Misau area, and then even in Jama'are local government. So what we did is to actually go into all the well in the town, that we contaminate the whole well in the town, 2,600 well. And then we informed the governor that he need to work on the water board, and that's what he's doing now. He's changing all the reticulation and piping, and then making sure that he expand the water to everywhere and to everywhere. And that was what is causing some of the problem we are facing today. They are still about 65% working on the water supply of Bauchi town. He even want to expand the water supply to
Dr. Iwan Mohammed. Dr. Iwan Mohammed, I'm afraid I have completely run out of time, but we do appreciate your contributions, and we appreciate your time on the program. And we've been talking with Dr. Rilwanu Mohammed, Chairman, Bauchi State Primary Healthcare Development Agency. Thank you very much indeed for coming on Nigeria Today.
Thank you, Nigerians.
All right, now, Dr. Kose, I don't know, in 15 seconds, your final comments, please.
Just to say, like, under the leadership of the Executive Director, Dr. Faisal, and our Honorable Minister, Dr. Hanire, we supported Benue State with vaccines, because there are vaccines that can be administered.
And
the same support is, and they are effective, and it was brought under control. Bauchi State, the federal government will continue to support Bauchi State also. Okay. And there's also a plan in the nearby future. We're trying to collaborate to see how we can bring in vaccine and have it administered routinely.
All right,
We look
Dr. Basio
forward.
Pose, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. It's been a pleasure having you on the program.
Thank you.
All right, Nigeria Today is live every weekday at 7:30 in the evening. Meanwhile, you can watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Victor Azo. Many thanks for watching.
Another unique